Hello, welcome back. Today we are going to discuss about blood transfusion in surgical and trauma patients. Our learning outline today will define blood transfusion. We shall discuss the indications for blood transfusion, the compatibility tests that are performed prior to blood transfusion, what are the major products and blood that are used for blood transfusion and when are they indicated, and then lastly we shall talk about complications and risks of transfusion. Blood transfusion is the procedure of introducing the blood of a donor or pre-donated blood by a recipient into a recipient's blood stream. Blood can be from another person of a compatible blood group, or a recipient himself may donate blood sometime back prior to the current incidence of demand of blood, and this blood can be utilized later on when it is highly needed by the patient or the client. Indications of blood transfusion is majorly, the major indication is hemorrhage, and hemorrhage can be classified into acute or chronic. Hemorrhage is also referred to as blood loss. In acute cases, indications for blood transfusion are when a patient or a person has lost more than 2 liters of blood or 2,000 mils, or in case the patient is having a very high rate of bleeding, or in case the bleeding rate is very severe. You may not quantify the amount of blood that has been lost, but in your clinical judgment, if a patient is observed to be losing a lot of blood, transfusion may be indicated. And in other cases, transfusion may be indicated in case the hemodynamic status of the patient has been compromised. If the patient is having low blood pressures, the mean arterial pressure is less than 40%, or the patient is having tachycardia, tachypnea, the patient is having hypotension, then you may need transfuse blood as fast as possible. In acute hemorrhage and in chronic hemorrhage, it is very wise and advisable to first arrest the cause of the bleeding as you do the transfusion, because doing transfusion minus arresting the cause of bleeding does not benefit the patient at all, because there will be no stoppage on the rate of bleeding. On the other hand, chronic hemorrhage or blood transfusion in chronic hemorrhage or chronic anemia is indicated in cases when hematocrit has dropped below 30%, or in cases the patient is exhibiting symptoms of hemorrhage and anemia. For example, gasping for air, breathlessness, dizziness, tachycardia, hypotension, cardiac failure. All those may indicate the patient's need for blood transfusion, and blood transfusion should be done as soon as possible. It should be noted that in chronic anemia and in all those conditions that could cause chronic loss of blood, maybe in sickle cell, hematocrit may be as low as 18 to 20%, and the patient may be able to tolerate such a decrease in hematocrit. And component therapy is also indicated in patients with specific conditions. For example, patients who are having hemophilia may need factor 7 concentrates for transfusion in order to treat such a given condition. Important tests are performed before blood transfusion is done in order to overcome the challenge of blood transfusion reactions, and these tests include ABO blood grouping, rhesus systems, and cross matching. The ABO blood grouping are guided by the principle which states that the donor's red blood cells react with recipient's plasma when a transfusion reaction is done. And it should be noted that different blood groups have different antibodies in their plasma and different antigens in their red blood cell membranes. For example, a person with blood group A has anti-B antibodies in their plasma, and they have type A antigens on their red blood cells, while a person with blood group B has anti-A antibodies and has antigen of type B on their red blood cells. While a person with blood group AB has no antibodies but has antigens A and B on their red blood cells, while a person with blood group O has both antibodies of blood group of type of anti-A antibodies and anti-B antibodies, but has no antigens on their red blood cell membrane. So as a result, a person with blood group AB is a universal recipient, and while a person with blood group O is a universal donor, because a person with blood group O has both antibodies but lacks antigens, and so can easily donate blood because his red blood cells won't have antigens to react with the serum antibodies of any given recipient. While on the other hand, a person with blood group AB is a universal recipient because they don't have antibodies in their plasma, and so they can receive any antigens, minus triggering a hypersensitivity or blood transfusion reaction. In some cases, when a fully cross-matched compatible blood is depleted or unavailable, type specific or blood negative type O should be given. This is advisable in case you're transfusing blood and you don't have the required transfusion blood type. You would give a blood group type O negative, since blood group type O, as we have just finished in the discussion, is a universal donor. The major transfusion products include cellular components and plasma components. And under the cellular components, we have whole blood, packed red blood cells, and plasma concentrate. While on the plasma components, we have fresh frozen plasma, cryoprecipitate, albumin, and plasma protein fraction. Whole blood is collected in citrate phosphate dextrose adenine solution, CPDA, and it contains 450 ml of whole blood and approximately 60 ml of anticoagulant pores preservative. As you can see, whole blood has 450 ml of containing approximately of whole blood and 63 ml of CPDA anticoagulant. When it is used within 24 hours, it is considered as fresh. When whole blood is given or administered within the first 24 hours, it is considered as fresh whole blood. While when it is given after this time, it is referred to as stored whole blood. And whole blood has a shelf life of 35 days, meaning that if whole blood is transfused after 35 days, it is no longer viable, meaning because the red blood cells would have died. In acute massive hemorrhage, transfusion with 1 unit of whole blood raises the recipient's hematocrit by 3%. Our next component or product of transfusion are the packed red blood cells. And packed red blood cells are the remains when plasma is separated from whole blood. And 1 unit of packed red blood cells raises the recipient's hematocrit by 3%. Packed red blood cells may be warmed to a temperature of not exceeding 37 degrees Celsius before transfusion is done. And the storage life of red blood cell is 35 days, as we had just discussed in the previous slide. This is an illustration of packed red blood cells, and it should be remembered that 1 unit of packed red blood cells raises the recipient's hematocrit by 3%. Another blood product is a platelet concentrate, and it's formed when platelets are separated from 1 unit of blood and then suspended in a small volume of original plasma. Depending on this technique, platelets may be stored for 3 to 7 days. 1 unit of platelet concentrate contains about 5.5 times 10 exponent 10 platelets, and it increases the platelet count by 5,000 platelets per mil, meaning that 1 unit of platelet concentrate raises the platelet count by 5,000 platelets per mil in the recipient's blood. This is an illustration of a platelet concentrate. And for patients with platelet count below 25,000 platelets per millimeter cubed, 6 to 8 units are usually given. And platelet concentrates must be administered through a special platelet filter. Another product of transfusion is fresh frozen plasma, And this is anticoagulated plasma separated from a person's blood and frozen within 6 hours of the time of collection, and it may be stored up to 1 year. And it contains all clotting factors and also provides proteins for blood expansion, that is plasma. And one more product of transfusion is cryoprecipitate. This is a protein fraction removed from a unit of fresh frozen plasma that is thawed at 40 degrees Celsius. And this white precipitate is then removed and frozen. It has a shelf life of about 1 year, and it contains factors 8, fibrinogen, and factor 13. Cryoprecipitate is used for treatment of classic hemophilia, as we have seen it contains those factors 8, 13, and fibrinogen, and it can also be used in the treatment of consumptive coagulopathy, such as disseminated intravascular coagulation and other clotting abnormalities with specific syrup when specific therapy is not available for treatment of the above mentioned coagulopathies. Complication and risks of blood transfusion. These are always less common, but in some cases they occur, and they can be outlined as a blood transfusion may be complicated with hemolytic transfusion reactions, non-hemolytic transfusion reactions. There may be transmission of disease second with blood transfusion. There is cytotoxicity, acidosis, and hyperkalemia. Hemolytic transfusion reactions. Intravascular hemolytic transfusion reactions are potentially life-threatening reactions that can occur by blood transfusion, and they are always second to ABO incompatibility, and their incidence is always 15,000 to 20,000. Their incidence is low, that is 1 per 15 to 20,000 transfusions performed. The pathophysiology behind the hemolytic transfusion reaction is hemolysis occurs when there is incompatibility between the recipient's blood and the donor's blood, and this results in hemoglobinemia, and hemoglobin is excreted in the urine, or hemoglobinuria, and this causes renal failure because hemoglobin is very cytotoxic and is an irritant of the kidney nephrons. So it kills the kidney cell tissues, and then you end up having renal failure. And so in addition to that, the transfusion reaction also activates complement system with subsequent releases of vasoactive amines, and this results in hypotension. More so, complement activation also initiates the clotting mechanism, which can produce intravascular thrombosis, disseminated intravascular coagulation, and hemorrhage. Patients with hemolytic transfusion reaction present with fever, chills, and dyspnea. And treatment of the hemolytic transfusion reaction is you first immediately stop the transfusion when you observe that the transfusion reactions are occurring, and then you administer fluids and diuresis with mannitol or furosemide. You give IV fluids and you give diuretics like mannitol or furosemide, and then transfused blood with patient's blood sample should be sent for analysis. You send the blood sample of the patient and that of being transfused for analysis to see what could be the cause of the problem. And then sodium bicarbonate may be administered to cause precipitation of hemoglobin in the renal tubules and prevent the incidence of renal failure. Steroids may also be given to alleviate the immunological consequences that could occur secondary to hemolytic transfusion reactions. Non-hemolytic transfusion reactions include febrile reaction, and this is always of a low incidence. It occurs in 0.5 to 1% of all transfusion, and is usually treated with giving or administration of antipyretic drugs. Other reactions include allergic reactions, and these ones occur in 2 to 3% of all transfusion, and they manifest with skin itching or urticaria and rashes. And they are managed by administration of antihistamines, steroids, or epinephrine. In addition to the above mentioned transfusion reaction, there could be spread of and transmission of diseases, and with exception of albumin and packed fresh frozen plasma, the use of all blood products carries the risk of transmitting infections. And these include the commonly spread infections secondary to blood transfusion include hepatitis, malaria, EBV, cytomegalovirus, brucellosis, and trypanosomiasis. And currently there is an increased risk of HIV spread secondary to a blood transfusion, and it has been adapted that a ELISA test should be done before blood is transfused. Like blood should be screened for HIV sensitivity before it can be even stored to be used for transfusion in the future use. Remember that blood transfusion is associated with severe complications, and so it should only be performed when it is clinically indicated. Thank you. I hope this presentation benefits us all in our learning and progression in our careers, and I hope to see you soon.